You're listening to Arun this Wednesday evening. Now, a report out today reveals that the number of cosmetic procedures, nose jobs, boob jobs, etc. in the UK are down. Now, you hear all sorts of horror stories about people going abroad for cosmetic surgery and it going wrong, very wrong in some cases, but we are still travelling overseas for treatment. So what do you need to consider if you're taking that path? Richard Wells is a Director of Healthcare at, I'll say Fin for now, but explain what that means. It means the Private Healthcare Information Network. It's a not-for-profit organisation that works to increase transparency in the healthcare sector. Richard, what's the report showing?
So the report's showing for us that kind of quarter three, actually overall, we've seen an increase in the number of people that are accessing private healthcare. I think, as you say, we've seen a bit of difference in kind of what people are going for. So actually, when we look at things, as you said, like boob jobs, nose jobs, things like that, the numbers are down slightly in the UK. So we collect from Fin, so as you say, that's the Private Healthcare Information Network. We collect data. We're a not-for-profit set up by government mandate, so we collect data from the private health sector and publish that every quarter. People can come to our website, so that is fin.org.uk. That's phin.org.uk. Appreciate the Fin doesn't. People might think it's an F. No, it's a P and an H. But in there, people can then look at kind of what the cost and quality is of private healthcare in this country. So we don't actually collect, as you said. I think that there are more people going abroad. The ONS do publish stats which is an estimate that say more people are going abroad for private healthcare. I think what we would say is come to the Fin website and look at the sorts of things that you can about quality care, cost of care in the UK, so they can see that what that would be over here. I think that will also and should give them a sense of the sorts of questions they'd want to be asking providers if they are looking to go overseas. So what are the outcomes like? What are the standards like? What's included in your kind of pre and post care package? Because again, I think providers overseas, they'll operate to many different standards and rules that we have here in the UK, and people should be going in with their eyes open. So coming to the Fin website will help people understand the sorts of things they can get here and the sorts of questions that kind of we ask and get from private providers, and that those are the sorts of things they should, I think, be thinking about when they're looking to go abroad. This
is something I'm really fascinated in, and by rather, because the follow-up care I understand. However, I know people that have been, let's say if you pick teeth, gone to the dentist with no pain whatsoever, and it ended up coming out with, let's say, a £1,200, £1,600 that bill on the back of it for some treatment at work, or they've wanted some work and they've paid quite a lot of money, or they've gone, right, I'm going to Turkey. They get Turkey teeth, they love their teeth, and granted they're not going to last forever and there's got to be some upkeep, but I was always anti it. And now I understand why loads of my mates have done it. When it comes to Botox, I understand why loads of people I know actually get it done by... And this is the worst thing. There's been a lot of people that are in the medical profession, whether it be NHS or private, that will sometimes do things on the side now, and people will pay a lot less. But going abroad, say, for hair transplants, all of that, it does, on paper, it just seems, to me anyway, it seems like the reasonable thing to do. It seems like it's far too expensive to do it here.
Well, I think people have always kind of had a choice. It's obviously a bit of a growing market, and I guess cost is one of the factors. Working based in London, see adverts on the tube with the prices they're quoting. So I can understand why people would go, but I think what I'd say is people do need to understand what's included in that, and they should be asking questions around that. So again, the Fin website, fin.org.uk, that'll show what you'd be getting over here. From your providers and the sort of cost that's involved, and that where your provider might be based, the sorts of patient satisfaction reports, that what patients are saying about the quality of care they've received, they can see that on a website, and those are the things they should be asking, I think, when they go abroad. So yeah, cost is one factor, I'm sure, but the others are really important too. I think people should be going in with their eyes open, really, and again, use our website. It's free of charge. We don't charge for our service. As I said, we're a government mandate, we operate by government mandate, so we're there to give transparency to data that people couldn't otherwise see. And I don't think that Fin feels pretty unique, actually. I don't think there is a Fin in other parts of the world, and so people won't necessarily have that transparency they got here. So they'll need to go armed with those questions themselves into any conversation with a provider overseas.
Why is it cheaper to do it overseas?
I'll be honest. I don't know if Finn has a view necessarily on that. I guess that there'll be all sorts of things built into that. Staffing costs may well be different. Just the cost of their infrastructure, operating theatres, whatever else. But again, I guess to some extent there might be a thing about you get what you pay for as well. So people, I guess, should be asking what sorts of services are available to them if there's a problem. So obviously, if people are going into providers here, that they can ask and understand what other services are available in the hospitals they're going into. They should be going in eyes open with what's available to where they're going overseas, because again, might not be access to potential other services they need if something unfortunately goes wrong.
I bet you've heard some horror stories.
Well, I'll be honest. What I've seen in the media, so probably seen what other people are seeing. So we look at the UK. We get the stats from the providers over here and publish those, and we get patient satisfaction stuff from providers in the UK. So again, really transparent. As I said, fin.org.uk will show what people are saying about the hospitals here. But I'll have seen obviously what's in the media and what gets reported from experience that people have had, which is again why I just say it's really important to go in with your eyes open, look at the sorts of things that bits of information we get from providers in the UK, and go in arms with the questions if you're going to go and look and access care overseas.
Magic. Richard, look, thank you so much for joining us. Just once again, if people want to check out that website, what is it?
It's fin.org.uk, and that's phin.org.uk.
Magic. Cheers, Richard. It's a really interesting conversation, isn't it? Those things. I used to think I'd get a nose job. True story. I was like, yeah. And then my mate said, no, it's a Roman nose, strong nose. And I went, yeah, now I'm okay with it. So I got it pierced.